Bismillah ar-Rahman ar-Rahim. I'm going to talk about multiple therapy for diabetes during Ramadan. And during management of people with diabetes who fasted during Ramadan, we studied the characteristics of a certain group of people with diabetes which were complications-free patients, and those patients were a cohort from the DAR Global Survey 2020 and 2022. Bismillah ar-Rahman ar-Rahim, from the Holy Quran, Shahr Ramadan الذي أنزل فيه القرآن هدى للناس, and again from the Holy Quran, ولا تقتلوا أنفسكم إن الله كان بكم رحيما. Don't kill yourself, God is merciful. And those are the countries with 2% or more of the world Muslim populations. And we have among them many countries who shared in the DAR Global Survey, like Egypt, Algeria, Morocco, Sudan, Turkey, Bangladesh, Pakistan, and India, and some other countries like UK. This analysis' main goal was to eliminate the characteristics and maintenance routine for complications-free patients living with diabetes during fasting Ramadan. Our data were obtained from the DAR Global Survey done 2020 and 2022. And in this group, we excluded patients on insulin or sulfonylurea, and no patients had macrovascular complications like coronary artery disease, heart failure, stroke, or peripheral vascular disease, or even TIA. We excluded those with microalbuminuria, diabetic foot complications, or patients with nephropathy or chronic kidney disease. And those are the patient characteristics. We had in this cohort 2,917 patients. 50% of them were females and 50% were males. And the age above 60, we had 25% of the patients, and the duration of diabetes more than 10 years, and long history of diabetes in 20% of cases, and 40% of the patients were not controlled, having hemoglobin A1C above 7.5%. These were the medications used: metformin, DPP-4 inhibitors, azolidine-diones, SGLT2 inhibitors, GLP-1 receptor agonist, and alpha-glucosidase inhibitors. And this is the percentage of each medication used. Metformin was the highly used medication in 72% of cases, followed by DPP-4 inhibitors in 32% of cases, followed by SGLT2 inhibitors in 20% of cases, then glitazones in 2.5%, GLP-1 receptor agonists in 2.3%, and alpha-glucosidase inhibitor in 1% of cases. For metformin, according to the DAR recommendation, it's safe for patients with type 2 diabetes to be treated with metformin monotherapy during Ramadan. There is no known randomized controlled trial conducted on metformin monotherapy. However, the risk of hypoglycemia is very low for this medication, so fasting is considered safe. For pioglitazone, this study was done comparing pioglitazone with sulfonylurea, and in DAR Global Survey, and due to the low risk of hypoglycemia with pioglitazone, no dose modification is required, and the dose can be taken either with iftar or with sahur. Again, another study done comparing sulfonylurea and DPP-4 inhibitors in combination with metformin, and the severe hypoglycemia happened double in the presence of sulfonylurea use compared to DPP-4 inhibitors. And in this study, the Virtue study, vildagliptin experience compared with sulfonylurea observed during Ramadan, which is a multinational study, and I had the honor to be one of the investigators, And the study results showed that there is significantly fewer patients experiencing hypoglycemia with vildagliptin versus those with sulfonylurea, and patients experiencing at least one attack of hypoglycemic event were increased 3.5 folds in those receiving sulfonylurea versus those receiving vildagliptin, and no severe hypoglycemia happened in the group receiving vildagliptin compared to 4 patients had severe hypoglycemia in the group receiving sulfonylurea. For SGLT2 inhibitors, the practical DAR guidelines 2021 about SGLT2 inhibitors, they have low risk of hypoglycemia. We consider initiating SGLT2 inhibitors 2 to 4 weeks before the start of Ramadan. There is some risk of osmotic diuresis, dehydration, and ketoacidosis, increased risk of urinary tract infection, postural hypotension due to lack of free fluid intake during fasting hours, and these are the concerns of the use of SGLT2 inhibitors during Ramadan in elderly patients, in patients with renal impairment, in patients with hypotension, those at risk of dehydration, and those taking diuretics. For GLP-1 receptor agonist, according to DAR guidelines 2021, they have low risk of hypoglycemia and should be started 2 to 4 weeks before Ramadan, at least to guard against GIT side effects. Dose reduction may be required when taken with sulfonylurea, or the reverse, we may reduce the dose of sulfonylurea, and dose reduction is recommended if there is severe nausea. These are the diabetes complications and comorbidities present in this cohort of patients. We have hypertension, or we had hypertension in 26% of the patients. Another 26% of the patients had dyslipidemia, retinopathy in 2.5% of the cases, neuropathy in 6.8% of the cases, and 20% of the patients did not have any side effect or complication or comorbidity. The patients who fasted during Ramadan were 87.5% of the total population, with a total of 2,548 patients. And the duration of Ramadan fasting for the complete 30 days, where 72% of the cases could complete the whole Ramadan. And the duration of breaking Ramadan fasting for few days, from 1 to 7 days, happened in 96% of the cases. Those who experienced hypoglycemia were about 8% of the patients, and the most important time for hypoglycemia was before iftar, between 3 p.m. and Maghrib time. It happened in about 90% of cases. And those patients who broke the fast due to hypoglycemia were 50% of the cases, and 6 patients went to the hospital to be admitted, or at least experienced some examination and support in the emergency room. What was the behavior of the patients after experiencing hypoglycemia? And these were the answers of the patients. 13% of the patients omitted some of the medications completely, 27% reduced the dose of medications, 4% reduced the frequency of the medications, 11% continued the same medications but stopped observing the fast, 13% increased the frequency of the monitoring by SMBG, 5% booked an urgent appointment with their doctor, 37% did nothing. They had hypoglycemia, but they did nothing, and they continued the same medication and same fasting. Hypoglycemia is a great risk in Ramadan, and this must be considered in selecting medications. In spite of using medications with low risk of hypoglycemia in those patients With diabetes, 8% of these patients experienced hypoglycemia. This is the hyperglycemia results among those patients who fasted, and 9.5% experienced hyperglycemia. And the incidence of hypoglycemia in 80% of the cases happened from 1 to 7 days during the holy months of Ramadan. The time of occurrence of hyperglycemia during the eating hours in 62% of the cases, and those who broke the fast due to hyperglycemia, it happened in 11% of cases. And after having attacks of hyperglycemia, what was the response of the patients? 35% cut down their food intake, 10% increased the dose of the medications, 3% increased the frequency of medications, 5% continued the same medications, but they stopped observing the fast, 13% increased the frequency of the monitoring, 5% booked an urgent appointment with their doctor, and 28% did nothing, the same medication and the same lifestyle. Then lifestyle is a cause of the hyperglycemia. Glycemic food should be taken into account. Sweets taken during Ramadan are sugary, may necessitate change in drug therapy. Again, medication or dietary tips may be needed. And self-monitoring and education were also studied during this cohort. And the first question, did you do SMBG during Ramadan or not? The patient said yes, but the first yes happened in 8% of the cases, yes, more frequently than before Ramadan. 12% said yes, but less frequently than before Ramadan. And 50% of the cases said yes, but at the same frequency during Ramadan. The frequency of SMBG in 28% of the patients were less than once weekly. And for receiving pre-Ramadan education, it happened in 55% of the cases, and mostly during the clinic visit in 63% of the patients, and 25% of the patients just received education through a leaflet. And let me finish with this study. We did it with our colleagues. Culturally based pre-Ramadan education increased the benefit and reduced the hazards of Ramadan fasting for type 2 diabetic patients. And this study showed that the pre-Ramadan education improved the awareness of patients toward hypoglycemia and also improved the behavior of the patient for hypoglycemia. Thank you very much.